Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. Today I'm going to review the important aspects or highlights of the last 6 videos that I have posted on my YouTube channel. So the first video was on importance of horses in the society. Some years ago, horses were part of our all activities, outdoor activities that we performed, whether it was plowing land, transportation of goods, transportation of people, to the point even invasion of different countries were done on the horseback. You may recall Ottoman Empire. This group of Turks went from Turkey all the way to most of the Europe. They conquered and ruled those areas for many, many years, many centuries, I would say. So they were on the horseback. But even today, horses play an important role in the entertainment, in the sports. As you can see on this picture on the right-hand side is a picture of playing polo on horseback. And other aspects of very useful things that horses perform, they are used for rehabilitation and for as a therapy for our children and adults who have got limitations of their health. But in some societies, horses are still utilized in agriculture assignments. As you can see here in the slide I showed you earlier, is from my assignment in Russia, where the horse buggy comes every morning and delivers this hay to the dairy cows. And then on the left-hand side, you see a beautiful Arabian horse from Oman country. And there are many, many horse shows of different breeds all over the world. Then the other video was about the anatomy of the reproductive tract of the mare. I mentioned, as you can see on the right-hand side, the reproductive tract is fixed in the mare, is fixed in the pelvic inlet. It's not as movable as we see in our cows. So here, when you put your hand in, you have to follow the reproductive tract rather than trying to retract it, just like we do in bovine. That does not, is kind of, dangerous to do in the mare. Pay attention to the ovaries. The location of ovaries is very unique. Just like you're looking at the clock, it's 2 and 10 o'clock. These ovaries are located. And then if you look at on the left-hand side, the ovary is a bean-shaped ovary. And it has got the kidney shape or bean shape. It has got that little indentation, what we call ovulation fossa. So regardless where the follicle is grown, as you can see the small right arrows showing, pointing the ovarian follicles. But regardless where the follicle is, whichever the biggest follicle is, they kind of move towards that ovulation fossa, and this is where the ovulation takes place. Then our common practice of palpation by rectum in the mare is very commonly done. I just wanted to point it out that it's very important to consider the safety of the animal as well as the operator. So you can see on left hand side on the top, the operator has a mare in the horse's stock, and then you see the barrier between the mare and the operator, and that is a kind of almost like a gate which is padded, and that is closed behind the mare. So if she gets restless, she would not be able to kick the operator, and the operator is safe, so is the mare. And then, as I mentioned before, once your hand is in, you have to kind of cup your hand, as you can see the bottom picture there, and then follow that uterus from one hand to the other. Now, when look about the physiology, we talked about that mare is a seasonally polyestrous animal which cycles in particular season of the year when we have long days and short nights. And then that really releases many hormones, and it obviously works with the photo period. And then our pineal gland of the mare plays an important role, and the melatonin hormone has a part to play in the control of the photo period. The typical estrous cycle is 18 to 24 days in the mare, but the estrus, or the heat, or the receptivity is very long. As you can see here, 4 to 7 days during breeding season. And the follicles get very big. As you can see here, I mentioned 40 to 50 millimeter in diameter. And you could imagine if you've got more than one follicle on that ovary gets very large. So we have to be careful about what we are palpating when we are inside there. And it is also very interesting that our researchers have followed these mares during breeding season. The follicles grow almost 3 millimeter a day. So you can almost predict, how the follicle, which is let's say 30 millimeters today, how big it's going to be in about 2-3 days. Now, when it comes to the breeding, most of the breeding places are operated by teasing the mare with the stallion first to find out if she is standing for the stallion. As you can see in this picture on the top, there is a solid barrier between the stallion, which is the other side, and you see back of the mare facing, the slide here. So the mare is receptive. She will raise her tail, she will urinate, she will wink, and does all kind of different things to show that yes, she is receptive. Versus if you have a mare which is not an estrus, she will be resentful. She'll be kicking around and pulling her hair, ears back, and that would be indication that mare is not an estrus. Now, the other way is that let the veterinarian do the ultrasound and look at the size of the follicle, which is very easily done by ultrasonography. And in that way, you can, breed the mare according to the size of the follicle, which I'll tell you in a minute here. So once the follicle is large, we can, let us say it gets to 35 or 40, we can induce that ovulation by giving this injection of human chorionic gonadotropin, HCG, which I mentioned here. And if we do that, estrus is in about 3 days or so, then ovulation takes place after that. So, but the follicle has to be at least about 33 millimeters in diameter to expect that HCG is going to work. Now, the other hormone which we use fairly commonly is the prostaglandins F2 alpha. Now that works only when you have a corpus luteum in the ovary. And you may recall the corpus luteum is not palpable by palpation by rectum, but on ultrasound you can see it easily. So if you give that prostaglandin F2 alpha, then the mare will come in heat in about 2 to 3 days. Then if our breeding is successful, now we are looking at a pregnancy. Pregnancy is also very unique in the mare. As you can see here on the top, the little graph shows you that there is production of equine chorionic gonadotropin, or ECG. At the bottom is the picture of the ECG production from endometrial cups. Endometrial cups come up as a part of the placenta in the mare. All the pregnancies in mammals that we deal with is supported by progesterone hormone. Now, in some species, progesterone is produced by ovary, and during all gestation lengths, they supported the pregnancy. But in the horse, in the mare, that corpus luteal progesterone is only good for about 70 days or so of the pregnancy, considering 11 months pregnancy. After 70 days, the placenta takes over. So that's the placental progesterone which maintains the pregnancy for the rest of the time. So you can see here that ECG becomes very unique and very important in terms of maintaining that pregnancy there. Then how we diagnose pregnancy? Obviously, we can do the palpation by rectum. And these pictures on your right hand side in black and white shows kind of approximate features or figures, to show you how that uterus gets bulged. And at 30 days, you see this much, and then 60 days is this much. It just requires some practice. And you can get pretty good at that. And then after about 80 days or so, that uterus gets so large, it's kind of, it comes down in the abdominal cavity, then it's very difficult for you to reach by hand through the rectum. So the best way would be to do transabdominal ultrasonography, which is again done very commonly. Then bring us to the foaling. Foaling or parturition in the mare has, again, I keep on overusing the unique word, but again, it's very unique that what we do is try to recommend our clients about month and a half before the due foaling date, please take that mare to the area where she's going to foal, whether there's a foaling stall indoor or the outside. In good weather, I think outside is not a bad area, a bad idea, but at the same time, we have to consider the weather conditions. If it's sunny, sunny time of the year, which is wonderful, but if there is a rain or snow expected, then we have to have some kind of shelter. Even in the stall, I think we need to make sure it's all clean. Fresh bedding is put in, and there is ventilation, proper ventilation, and enough area for the mare to move around. So that is kind of, starting about 4 to 6 weeks before due foaling. As we get close to the foaling, maybe a few days or so, you would see that there is enlargement of the udder, and there is a waxy secretion, what we call waxing of the udder, that you see a few days before, the mare foals. Now, when that time comes, a few days before, you have to make sure that we wrap the tail nicely and clean the perineal area and the udder, so that when foal comes in, does not get any contamination from that area. Now, the stages of foaling. I mentioned in my video that it's not really stages that one stage comes and then there's interval. This is a continuous process. But for our description purposes, we divide this process in 3 different steps. So the first stage of this parturition or foaling is where mare feels very uncomfortable. She moves around, she rolls on the ground, she lays down, she gets up. You see the signs just like you have seen mare with a colic. So the colicky kind of symptoms you will see. So this mare, is in that way. At that time, many of our experts feel that the foal also try to position itself in the uterus. And then we have a chorioallantois appears from the vagina. And then pretty soon you have got this big air, balloon type stuff, what you call water bag. And when it bursts, chorioallantois, that makes this animal to now push hard to deliver the foal. So that puts in the second stage of foaling, or the fetal expulsion, and which is also very explosive. A process lasts, about 30-40 minutes. So you could see here the second stage of 20 to 30 minutes, I should say, and then fetus comes out. If you have a mare which is pushing and it has been more than 30 minutes, I think we need to figure it out, to maybe get inside and figure, to see if there are any barriers, any dystocia, difficult birth, and we will talk at some other time how to correct that. And then after the foal comes out, you could bring foal close to the mare, or mare close to the foal, to let sniff the foal, and then create that bonding. And the third stage is the expulsion of placenta, which also comes out very quickly, within 2-3 hours. And the placenta stays in for more than 3 hours, then again we have to think about how to have the placenta come out. And again, we'll talk about retention of fetal membranes in our next video. So with that, I hope this video was helpful to you. And again, I did this review so that you know the important aspect of mare reproduction. And then we will continue, and next few videos will be on infertility diagnosis of the mare. Why mare does not cycle, or if we breed her, why doesn't she get pregnant, and what to do about that. So I hope you'll join me. Until then, I wish you well. Bye-bye.